information. I'm Randy Alvarez. Today's topic, bioidentical hormone replacement therapy. We're here with hormone expert, Dr. Sangeeta Paddy. Dr. Paddy, let's start with the commonly replaced hormones.
The estrogens, and you have to look at all three of them. Progesterone, testosterone. The metabolic hormones, which are thyroid, insulin, and cortisol. Insulin and cortisol actually go up, so you're not replacing them, but you're balancing them.
Okay.
Then you have DHEA, hormone of immunity, melatonin, known for its sleep effects, but really an anti-cancer hormone, pregnenolone, which is a hormone of memory and concentration, and growth hormone, which is the major hormone affecting connective tissue, muscle, fat, skin, bone.
How does somebody know if they have a thyroid problem? What are the symptoms?
Symptoms of thyroid: fatigue, depression, mid-abdominal weight gain, lack of mental clarity, brain fog type feeling, falling hair, dry skin, puffy eyes, plus minus. Sometimes people get swelling in the legs, swelling in the hands.
Have you had patients that on testing or on tests show low thyroid or whatever, and it's turned around immediately? Where these symptoms go away right away?
Within 4 to 5 weeks.
What about weight loss? I think of thyroid as this metabolic, I've always wanted thyroid, by the way.
It is a metabolic hormone, and interestingly enough, the hormones that I mentioned actually decline in everybody by age 50. So for example, thyroid, no matter where you're testing, by age 50, you're at 50% function for thyroid.
So they would be candidates.
And they would be candidates.
What about those people? And I hear this all the time. It's happening to me right now. I can't lose weight the way I used to. Is thyroid plays a role there?
Thyroid does, and so does the entire model that I was telling you about.
So it's not just one hormone, obviously.
No, it's not just one hormone. The thyroid activates progesterone. It activates estradiol. The cortisol suppresses the thyroid.
Okay.
The cortisol, which is the stress hormone, also activates insulin resistance. So usually when people in their late 30s and 40s start to gain weight, we're talking about people who have insulin resistance. And everybody
Can that be turned around?
It absolutely can be turned around, but it needs to be turned around by focusing on all 5 areas.
Okay.
And what I have found is traditionally if you focus on one area, oh, I think I'll just take some chromium. You see these products on the shelf all the time. Yeah. Or maybe I should just take some thyroid. But if you don't have the selenium and the zinc, the thyroid won't work. So that's why it becomes so critical to look at all the pieces. Okay. And indeed, we have an outstanding mechanism of reversing metabolism in the form of a weight loss program.
In your practice?
Yes, and that's exactly what you do, is you
Putting it all
look at
together.
each component, right.